Welcome to our deep dive today. It's all about Alzheimer's disease.
Uh-huh.
You know, it's one of those things I think everyone wants to know more about,
Definitely.
and we're really going to try to unpack it. We've got
Yeah.
this great article, Understanding Alzheimer's in 2024, Signs, Causes, and Care Options,
Oh, okay.
from the Advocate Voice. And yeah,
Cool.
we're going to use that to cover a lot
Yeah.
and talk about, some early signs and really what's happening in the brain,
Right.
and then even get into treatment and prevention. But before we even do that,
Okay.
here's a surprising fact. You know how we think of Alzheimer's as like an older person's disease?
Yeah.
Well, you can actually see early onset Alzheimer's
Oh, wow.
as young as 40.
That's a lot younger than I would have thought. That's definitely a reason to, get informed.
Yeah, and understand it no matter how old you are.
Absolutely.
So let's start with the basics. What exactly Alzheimer's disease?
Okay.
And how is it different from dementia?
Yeah, that's a really good question.
I know those terms get tossed around a lot,
Yeah, they do.
but are they the same thing?
So dementia is actually like a broader term, like an umbrella.
Oh.
It covers a whole bunch of conditions that affect memory and thinking. Alzheimer's disease is actually the most common type of dementia, making up like a huge 60 to 80% of all dementia cases.
Oh, wow. So Alzheimer's is like the dementia.
Pretty much.
But what's actually going on in the brain when someone has Alzheimer's? What is causing this decline?
So in Alzheimer's, the brain cells start dying off, a lot faster than they should with normal aging.
Okay.
And that leads to kind of a brain shrinkage, which doctors call brain atrophy.
Okay.
Now, researchers have discovered two main things that happen.
Okay.
They're called amyloid plaques and tau tangles.
Ew, those sound kind of scary.
Yeah, they're not great.
Can you break those down?
Yeah.
What are they
Yeah.
exactly?
So imagine your brain cells need to communicate with each other.
Okay, yeah.
Amyloid plaques are these sticky clumps of protein that build up between them,
Okay.
like roadblocks,
Uh-huh.
stopping those communication pathways.
Oh, okay.
Tau tangles, on the other hand,
Uh-huh.
those are twisted fibers that form inside the brain cells, causing them to, break down and die.
So it's like a double whammy. You got these roadblocks, and then you got these tangles choking them from the inside.
Yeah, that's a good way to put it.
So no wonder there are cognitive problems. It's
Exactly.
like a 1-2 punch to the brain.
Yeah. And one of the areas of the brain that gets hit hardest and early on is the hippocampus.
Oh, the hippocampus. That's the memory
Mhm.
center, right?
You got it. It helps us form new memories
Right.
and find old ones
Okay.
because it's affected so early.
Right.
Memory loss is like the first noticeable symptom.
That makes sense. Okay, so this is all kind of heavy,
Yeah.
but really good to understand what's actually happening.
Right.
Because it makes you think, okay, that's why these symptoms are happening.
Definitely.
So, speaking of symptoms, let's talk about how to spot the signs.
Okay.
You mentioned memory loss.
Yeah.
What are some specific red flags?
So, we have to separate normal age-related memory stuff
Right.
from the kind that might be something more serious.
Uh-huh.
Yeah.
Because we all have those senior moments.
Oh, yeah, all the time.
But when does it become a problem?
When it's more frequent,
Okay.
it starts affecting your daily life.
Okay, so give me some examples of what you mean.
Okay, so think about this. Putting your keys in the fridge.
Oh, wow.
Or, like, your phone in the cereal box.
Okay, yeah, that's not normal.
No, not really.
Okay, what else?
Maybe forgetting conversations you just had
Okay.
and asking the same questions over and over.
Gotcha. So that's more than just misplacing your keys.
Right. It's those memory slips that should really make you pay attention.
Yeah, that's good to know. So what about other symptoms besides memory loss?
Okay, sure.
What about cognitive and behavioral changes?
So, as the disease progresses, you'll probably see changes in thinking and reasoning. Okay. People might get confused about time or place, have trouble with routines,
Okay.
or even finding the right words.
Like they just can't think of the word.
Yeah, or they might even, substitute weird phrases for common things.
Oh, like what? Give me an example.
Instead of toothbrush, they might say, mouth cleaner.
Mouth cleaner. Haha. Okay, yeah, I can see that.
Right, or maybe they'll pause a lot when talking,
Right.
trying to remember that word.
Wow, it seems like that would be super frustrating.
Definitely. And it can be a sign that something's going on.
So we got the memory stuff, the thinking stuff.
Yeah.
What about behavior?
Yeah, so increased anxiety,
Okay.
mood swings,
Mhm.
those are common.
Okay.
You might see anger, frustration, even depression.
So these are all tied to that fear and confusion
Yeah, I think so.
as the cognitive stuff declines.
Exactly. It all affects their quality of life,
Yeah, absolutely. And it really highlights why If you see these changes in someone, it's so important to get professional help.
Absolutely.
Like, don't just write it off as getting older.
You can't just ignore it.
Yeah. Early diagnosis is so important.
It really is. And it helps families understand what they're dealing with and make better decisions about care.
That makes sense.
Yeah.
So let's talk about the causes of Alzheimer's. Is it purely genetic, or is it lifestyle too?
It's kind of both
Okay.
nature and denurture.
Okay, so what about the genetics?
There are genes like APOE4
Uh-huh.
that can raise your risk.
So if your family has it, does that mean you'll get it?
Not necessarily. Some with that gene don't get it,
Oh, okay.
and some without it do.
Wow, so genes aren't the whole story.
Right. Lifestyle choices can really matter too.
Okay, so what kind of lifestyle things are we talking about?
Diet, exercise, how you engage your mind.
It's like taking care of your brain.
Exactly.
Yeah.
Like you take care of your body.
I like that. Okay, what kind of diet are we talking about?
Two come up a lot. The Mediterranean diet
Okay.
and the Mindy diet.
Okay, what's in those?
Lots of good stuff. Whole grains,
Uh-huh.
fruits and veggies, healthy fats like olive oil,
Okay.
lean proteins.
So basically eating delicious food.
Pretty much. Think lots of color, fresh fish,
Okay.
nuts and seeds.
That sounds good to me. Okay, what about exercise? What's best for the brain?
Aerobic exercise is great.
Like what?
Brisk walking, swimming, dancing.
Okay.
Anything that gets your heart rate up
Right.
and blood flowing to your brain.
So you don't have to be a marathon runner.
No, just get moving.
Okay, got it. Now what about mental stuff?
Yeah, keeping your mind sharp is key.
How do you do that?
Challenge yourself.
Okay.
Learn new things, puzzles, reading, a new language, even just good conversations.
Okay.
This builds cognitive reserve.
Cognitive reserve, like a shield.
Yeah, like a buffer against those age-related changes.
Okay, so lots of healthy habits can help.
Yeah.
But what if someone's already showing signs?
Right.
How do you actually diagnose Alzheimer's?
So it's a process.
Okay.
It starts with a medical history,
That's
physical exam,
Right.
lots of questions about memory, cognitive function. Then they might use cognitive tests.
Oh, like those memory tests?
Exactly.
Yeah.
They see how your brain's working.
Gotcha. Anything else?
Yeah. They might use imaging, like MRI and PET scans.
And what do those show?
Well, MRIs can show brain shrinkage,
Oh, wow.
and PET scans can show brain activity
Mm-hmm.
and even amyloid plaques.
Wow, so we can actually see those?
Yeah.
That's amazing.
Yeah.
Are there any other tools coming out?
Yeah, there's a lot of research happening.
Okay.
One thing is blood tests that can find specific proteins that are linked to Alzheimer's.
So it could be easier to diagnose.
Yeah, simpler and less invasive.
That's great. So
Yeah.
early diagnosis is important, but why? What are the benefits?
It lets people plan for the future,
Oh, okay.
make good decisions about care,
Right.
and get treatment when it's most effective.
Yeah, that makes sense. Okay, we've been talking a lot about the disease.
Uh-huh.
Let's talk about treatments. Is there a cure?
Sadly, no, not yet.
Okay, so what can you do?
Well, there are treatments that can help manage the symptoms
Okay.
and maybe slow the disease down
Okay.
and improve quality of life.
So it's about making the most of the time they have left.
Exactly. And the treatment options are always changing.
So what kind of medications are out there right now?
Well, one class is called cholinesterase inhibitors.
Okay, and what do those do?
They increase levels of a neurotransmitter called acetylcholine.
Uh-huh. And what's that?
It's really important for memory and learning.
So it's like they're giving the brain a
Yeah.
boost.
Yeah, like a little helper.
Okay, cool. Are there other medications?
Yeah, there's one called memantine.
Okay.
It works differently.
How so?
It regulates glutamate,
Okay.
which is also involved in learning and memory.
Gotcha. And when is that one used?
Usually for moderate to severe Alzheimer's.
So it seems like we've got some meds to help manage things,
Right.
but is there anything that can actually slow it down or even reverse it?
Okay, this is where it gets really exciting.
Okay, tell me.
We're starting to see new medications
Yeah.
called anti-amyloid drugs,
Oh,
like lecanemab.
and what do those do?
They target those amyloid plaques we talked about.
Okay, the roadblocks.
Exactly.
So they clear those out.
Yeah, lecanemab has been shown to clear them from the brain.
So it actually slows down the damage.
Yeah, potentially.
Wow, that's amazing. What other research is going on?
So much. There's gene therapy, immunotherapy,
Okay.
even vaccines.
Wow, so it's looking hopeful.
Very hopeful. It's still early, but there's a lot of potential.
That's great to hear.
Yeah.
But let's not forget the day-to-day challenges,
Yeah, of course.
both for the person with Alzheimer's and their caregiver.
Absolutely.
What does the article say about that?
Well, it talks about how important communication is
Okay.
and how to really connect with someone who has Alzheimer's.
I imagine that's got to be tough.
Can be.
So what are some tips?
Well, you got to adjust your communication style. Simple language,
Huh.
short sentences, familiar words.
Oh.
Avoid, like, jargon.
Right.
And speak slowly.
Okay.
Maintain eye contact.
Right, so they can really understand.
Exactly. It's all about making them feel safe and supported.
That makes sense. But what about when they get confused?
Yeah.
Or forget something?
So it's natural to want to correct them,
Uh-huh.
but that can actually be bad.
Oh, really?
Yeah, instead of correcting, just
Right.
redirect the conversation or change the subject.
So just go with it.
Yeah, meet them where they are.
That's a good way to put it. Okay, the article also talks about routines.
Yeah, routines are important.
Why is that?
They give a sense of structure,
Uh-huh.
predictability,
Right.
which is comforting.
So what kind of routines are we talking about?
Having set times for things,
Good.
waking up,
Mm-hmm.
meals, bathing, bedtime.
So they know what to expect.
Exactly. It helps reduce anxiety.
Any other practical tips?
Simplify tasks.
Yeah.
Break them down into smaller steps.
So instead of get dressed,
Right.
what would you say?
You might lay out their clothes in order
Oh, that's smart.
or help them with the first few steps.
Yeah, that makes sense. Okay, we've talked about practical stuff.
Right.
But caregiving is emotional too.
Absolutely.
How does the article address that?
It says caregivers need to take care of themselves.
It makes sense.
Get support.
Okay, like what?
Support groups, therapy, respite care.
It's easy to get burnt out.
Yeah, if you try to do everything yourself.
What are some good resources?
The Alzheimer's Association is great.
Uh-huh.
They have support groups, info, even a 24/7 helpline.
Wow, that's amazing. Are there local resources too?
Yeah, a lot of community centers and hospitals have programs.
Okay,
Yeah.
so there's help out there.
Definitely.
The article also mentions planning for the future.
Yeah, that's crucial.
What are some things to consider?
Financial and legal stuff.
Like what?
Talking to a financial planner.
Okay.
Setting up power of attorney. Healthcare directives.
Mm.
Making sure your will is updated.
Yeah, it's not fun to think about.
No, but it's important.
So you're prepared.
Exactly.
Okay, let's talk about prevention again.
Sure.
We talked about a healthy lifestyle.
Right.
But what can people do to protect their brains?
Diet, exercise, mental stimulation.
We keep coming back to those.
Yeah, they're key.
What about those diets again?
Mediterranean and mindy.
Yeah, those. Why are those so good?
They have nutrients that support brain health.
Okay, so it's not just about tasting good.
Right, it's about fueling your brain.
Okay, and exercise. What's the recommendation?
At least 150 minutes a week.
Of what?
Moderate intensity stuff.
Okay, like what?
Brisk walking, swimming, anything that gets your heart rate up.
Got it. And mental stimulation.
Challenge your brain, learn new things.
Like those puzzles.
Puzzles, reading, hobbies, conversations.
So stay active and engaged.
Exactly. Keep learning.
Okay, so there are things to do. Are there things to avoid?
Definitely. Smoking, for example.
I figured that one.
It damages blood vessels,
Mhm.
including those in the brain.
Okay, so it's not just bad for your lungs.
Right. It affects everything.
Okay, what about stress?
Stress is tricky.
How so?
A little stress can be good,
Uh-huh.
but too much.
Right.
Chronic stress is bad for your brain.
So we got to find healthy ways to manage it.
Absolutely. Self-care is so important.
For everyone, not just caregivers.
For everyone, exactly.
Okay, so we've covered a lot today.
We have,
From understanding Alzheimer's to treatments,
yep,
to caregiving, to new research.
it's a lot.
Before we move on to part 2,
Okay.
I want to talk about those new treatments.
Yeah.
You mentioned some amazing breakthroughs.
Yeah, it's an exciting time.
What are you most excited about?
Disease-modifying therapies.
Okay, tell me more.
These are treatments that go after the cause of Alzheimer's.
Not just the symptoms.
Exactly.
Wow, that's amazing.
It's a whole new way to approach treatment.
Okay, and we'll dive into those
Yeah.
in part 2 of our deep dive.
Looking forward to it.
All right, we're back.
Yep.
Ready to keep going with our deep dive into Alzheimer's.
Uh-huh.
And in this part, we're going to get really practical.
Okay.
What can you actually do with this information?
Yeah, that's important.
We've talked about recognizing the signs.
Right.
But now, let's get into what it's like to care for someone with Alzheimer's.
Okay. Sure.
And how to best support them.
Yeah, because it's one thing to understand it all, like in theory,
Right.
but it's a whole other thing to deal with it every day.
Totally.
Yeah.
And that's where this article is great.
Yeah, it's got some really helpful advice.
Especially for caregivers.
Absolutely.
Especially when it comes to communication.
Oh, yeah, communication is huge.
Because I imagine talking to someone with Alzheimer's can be really hard.
It can be tricky. Yeah.
Their thinking is changing, so how do you connect with them?
Right. So the article talks about adjusting your communication style.
Okay, so how do you do that?
Use clear and simple language.
Okay.
Short sentences, familiar words, no jargon.
Right. Keep it basic.
Exactly. And then speak slowly.
Okay.
Maintain eye contact.
So they can really process it all.
Yeah, it's about making it easy for them to understand.
Right. And I bet your tone matters too.
Oh, absolutely. Gentle and reassuring.
Okay, so you create this safe, supportive vibe.
Exactly. Now, one thing caregivers always ask about
Yeah.
is what to do when the person gets confused.
Oh, yeah. That's got to be tough.
It is. You want to correct them, right?
Yeah, your instinct is to be like, no, remember.
Right, but that can actually make it worse.
Oh, really? So what should you do?
Instead of correcting, just redirect.
Hmm.
Gently change the subject.
So just kind of roll with it.
Yeah, meet them where they are.
I like that. Okay, the article also talks about routines.
Routines are like lifesavers.
Why are they so important?
They give that structure and predictability,
Right.
which can be really comforting.
Okay, so when you're confused and disoriented,
Yeah,
having those familiar things.
it can make a big difference.
So what kind of routines should you set up?
Having consistent times for things.
Like what?
Waking up, meals, bathing, bedtime.
So their day has a rhythm to it.
Exactly. It reduces anxiety.
Makes sense. Any other tips?
Simplifying tasks is a big one.
Okay, break things down.
Exactly. Instead of get dressed,
Right.
you might lay out their clothes in order
Oh, I like that.
or help them with the first few steps.
So it feels less overwhelming.
Right. It's all about making things easier.
That's great advice.
Yeah.
But we got to talk about the caregiver, too.
Oh, yeah.
We've talked about all the practical stuff.
Right.
But caregiving is emotionally draining.
It absolutely is.
How does the article address that?
It emphasizes self-care.
Okay, so the caregiver needs to take care of themselves, too.
It's crucial. They need to get support.
Like what kind of support?
Support groups, therapy, even just taking breaks.
It's respite care, right?
Yeah, respite care is great. It gives them a chance to recharge.
Because otherwise you get burnt out. What are some good resources for caregivers?
The Alzheimer's Association is amazing.
We keep coming back to them.
Yeah, they're a great resource. Support groups,
Oh,
info, a 247 helpline.
wow. So you can call anytime.
Anytime. You're never alone.
That's good to know. What about local resources?
A lot of community centers and hospitals have programs.
Okay, so it's worth looking into those.
Definitely. There's help out there.
The article also mentions planning for the future.
Yeah, that's something people don't like to think about.
No, it's hard.
But it's so important.
What kind of planning are we talking about?
Financial and legal stuff.
Like what?
Talking to a financial advisor.
Okay.
Setting up power of attorney, healthcare directives.
Right. Making sure your will is up to date.
All that stuff. It's not fun, but protects everyone.
So you're prepared for whatever happens.
Exactly.
Okay, let's go back to prevention for a minute.
Sure.
We talked about a healthy lifestyle.
Uh-huh.
What are some specific things people can do?
It all comes back to those basics. Diet, exercise, mental stimulation.
They really are the foundation.
They are. And those diets we talked about, Mediterranean and mine,
Yeah, what about them?
they're not just tasty.
Right.
They're packed with brain-boosting nutrients.
So eating well is key.
It really is. What about exercise?
What's the recommendation?
At least 150 minutes a week.
Of what?
Moderate intensity exercise.
Like what?
Brisk walking, swimming, dancing.
Okay, got it.
Mhm.
And mental stimulation.
Challenge your brain. Keep learning.
Okay, how do you do that?
Puzzles, reading, hobbies, new skills, good conversations.
So stay curious.
Yeah, keep that brain active.
Okay, so things to do. Are there things to avoid?
For sure. Smoking is a big one.
Yeah, we all know smoking is bad.
Right, but it's especially bad for your brain.
Oh, how so?
It damages blood vessels, including those that feed the brain.
So it's like starving the brain of oxygen.
Yeah, basically. It increases your risk of all kinds of problems.
Okay, so smoking is a no-no. What about stress?
Stress is tricky.
How so?
A little stress is normal, even good for you.
Yeah.
But chronic, overwhelming stress,
Right.
that's bad for your brain.
Okay, so it's about finding healthy ways to cope.
Exactly. Self-care is so important.
We'll keep coming back to that.
For a reason, taking care of yourself,
Right.
both mentally and physically, that helps protect your brain.
Okay, we've covered a lot in this part.
Yeah.
From practical tips to self-care
Yep.
to planning for the future.
It's a lot to take in.
But before we move on to part 3,
Okay.
I want to circle back to those new treatments.
Okay. Yeah, the breakthroughs.
You mentioned disease-modifying therapies.
Right, they're game changers.
So how could they change things for people with Alzheimer's?
Well, imagine instead of just managing symptoms,
Uh-huh.
we could actually modify the disease itself.
Wow. So slow it down, maybe even stop it.
That's the goal.
That would be incredible.
It would be revolutionary.
So tell me more about how these therapies work.
There are a few different approaches. One that's really promising is immunotherapy.
Okay, and what's that?
It's using your body's own immune system
Okay.
to fight Alzheimer's.
So it's like training your body to defend itself.
Exactly. Some immunotherapies use antibodies
Yeah.
that target those plaques and tangles.
Like little guided missiles.
Yeah, that's a good way to put it.
They mark the bad stuff for destruction.
That's the idea.
That's pretty amazing. What about gene therapy?
Gene therapy is more complex,
Okay.
but it has huge potential.
How does it work?
It involves introducing genetic material into cells to either fix faulty genes
Okay.
or boost helpful proteins.
So in Alzheimer's, you'd be targeting those risk genes
Yeah, like APOE4.
or increasing protective proteins.
Exactly. It's about making the brain more resilient.
Wow, that's mind-blowing.
Yeah.
So we've got these medications,
Uh-huh.
but are there other innovations in care that you're excited about?
One that's getting a lot of attention is personalized medicine.
Okay, what's that?
It's the idea that everyone's Alzheimer's is different,
Right.
so treatment should be tailored to the individual.
That makes sense. So it's not one size fits all.
No, it's about finding the best approach for each person.
Okay, so we're moving towards more personalized care.
That's the direction we're heading in.
That's really exciting. These developments give us a lot of hope.
They do. But we can't forget the challenges.
Yeah, absolutely.
Living with Alzheimer's is tough.
For everyone involved.
For everyone. And I want people to know they're not alone.
That's so important.
There's so much support out there.
Okay, like what?
The Alzheimer's Association, community groups, online forums.
It's about finding that community.
Exactly. People who understand what you're going through.
And don't underestimate those small acts of kindness.
Oh, yeah, those matter so much.
Spending time with someone, offering help, just listening.
All of that makes a difference.
This has been a really great conversation.
It has.
We've learned so much about Alzheimer's.
We covered a lot of ground.
From the science to the caregiving
Yeah.
to those hopeful new treatments.
It's a lot to process.
But before we wrap up in part 3,
Okay.
I want to talk about the future.
The future of Alzheimer's.
Yeah, all those exciting advancements you
It's
mentioned.
it.
Okay, we're back for the last part of our Alzheimer's deep dive.
Uh-huh.
And I gotta say, I'm feeling pretty hopeful after our last conversation.
Yeah, me too.
We talk about so many things you can do, right?
Absolutely.
To maybe reduce your risk and how to care for people.
Right.
But now I want to look ahead.
Okay.
What's the future hold for Alzheimer's?
The future.
Yeah, like you mentioned some amazing research happening.
Oh, yeah. There's a lot going on.
So let's talk about those disease-modifying therapies.
Okay. Those are big ones.
They're not just about making you feel better.
No, not at all.
They're about tackling the root cause.
Right. Getting to the source of the problem.
So how could these therapies actually change things?
Well, it's a huge shift in how we think about treatment. Imagine, instead of just dealing with symptoms, you're actually changing the disease itself.
So slowing it down, maybe even stopping it.
That's the dream.
Wow, that would be amazing. Could we actually be talking about a cure someday?
It's still early to say cure,
Okay.
but the possibilities are definitely there.
Can you give me some more details about how these therapies work?
Yeah.
I know there are a few different kinds.
Yeah, there are a few approaches being studied.
Okay.
One that's really exciting is immunotherapy.
Okay, yeah, you mentioned that before.
It's basically using your own body
Yeah.
to fight off the Alzheimer's.
So it's like boosting your natural defenses.
Yeah, exactly. Like
Yeah.
giving your immune system a superpower.
That's awesome.
Yeah.
So how does it actually work?
Well, some immunotherapies use antibodies
Okay.
that target those plaques and tangles we talked about.
Oh, right, the roadblocks and the tangles.
Yeah, those guys. And the antibodies,
Uh-huh.
they basically mark them for destruction.
So the immune system knows to attack them.
Exactly. It's pretty incredible.
It is. Okay, what about gene therapy? You mentioned that too.
Gene therapy is a whole other level.
Okay, how so?
It's more complex,
Uh-huh.
but it has the potential to be even more effective.
So what's the idea behind gene therapy?
It involves actually changing the genes.
Wow, right?
Either fixing the bad ones or adding good ones.
So like you're going in and editing the DNA.
In a way, yeah. For Alzheimer's, they're looking at targeting Those risk genes.
Like that APOE4 gene?
Exactly.
Or maybe even adding genes that protect the brain.
That's the hope.
It's like science fiction coming to life.
It is pretty amazing.
So we've got these medications, gene therapy. Are there other innovations in care that you're excited about?
Well, one that's gaining a lot of traction
Right.
is personalized medicine.
Personalized medicine, what's that?
It's the idea that not everyone responds to treatment the same way.
Okay, yeah, that makes sense.
So instead of a one-size-fits-all approach,
Right.
you tailor the treatment to the individual.
So everyone gets a plan that's specific to them.
Exactly. You take into account their genes, their lifestyle, how their disease is progressing.
That seems like a much better approach.
It's definitely the future of medicine.
Wow. So much to be hopeful for.
Definitely.
Feels like we're really making progress with Alzheimer's.
We are. There's no doubt about it.
But even with all these advancements,
Yeah.
it's still a tough journey.
Absolutely. For everyone involved.
What would you say to people facing that journey?
You know, more than anything,
Uh-huh.
I want them to know they're not alone.
That's so important.
There's support out there.
Yeah. Where can they find it?
The Alzheimer's Association is a great resource.
Right. We've talked about them a lot.
And there are local groups, online communities.
It's about finding those people who understand.
Exactly. Sharing experiences, offering support.
And sometimes just knowing you're not alone.
Right.
That makes all the difference.
It really does.
And never underestimate those little acts of kindness.
Oh, absolutely. Those go a long way.
Spending time with someone, helping out.
Just listening, being there for them.
Those things matter.
More than you know.
Well, this has been an incredible deep dive.
It has.
We've learned so much about Alzheimer's,
We've covered a lot of ground.
from the very basics to the latest research.
And everything in between.
And I hope you listening feel informed and empowered.
That's the goal.
Remember, there's help out there.
Always.
You're not alone.
Never.
Keep learning, keep connecting, and keep those brains healthy.
Couldn't have said it better myself.